Well, a big welcome to our nephew community, and I'm very excited about our podcast today. I hope you are also. Our mission at NephU is to improve the future outcomes for individuals with kidney disease and other related conditions. My name is Sean George, Clinical and Scientific Director with Otsuka. I will be serving as your host for today's podcast. I am very fortunate to have Dr. Biruh Workeneh join me today to share his expertise and provide a clinical overview of nephrolithiasis, also known as kidney stones. Dr. Workeneh, thank you so much for joining us today.
Oh, it's a pleasure to be back, Sean. So I'm excited to talk about this painful topic in more
Yeah,
ways than one. So, which we'll get
yeah,
to.
no, absolutely. We're excited to have you. So I think I want to start off by tackling the question that we should probably start with, right? Is what is a kidney stone and how do these painful stones form?
Okay, so big picture is that much of our audience today will have had kidney stones at some point in their life, or if they haven't already, then approximately 1 in 10 will. So this thing is extremely common. It's a common condition, and essentially it's in the name. It's essentially a stone or a crystal that forms in the kidney. And often when it forms, it's asymptomatic, and when it is symptomatic, uh, you'll know. In short, it's extremely painful as the stone passes from the kidney down through the to the bladder and to the out to the free world. And so we'll get more into that, but essentially it is a condition where minerals combine into crystals and what appears like stones, where the name comes from, and causes problems, especially if it blocks the flow of urine, and it can result in acute kidney injury, infections, other complications we can also talk about.
Yeah. So it's not just passing the stone. There can be other complications that come along with it. And
Hmm.
most people say this is, it is a urological condition.
Hmm.
The urologists manage it, but nephrologists are involved too, right? So tell me a little bit about how nephrologists kind of get involved in the diagnosis of kidney stones and where nephrologists play a role in it as opposed to a urologist.
Of course, of course. During an acute episode, certainly the urologists are the superstars. They're the ones who come in and do the procedures to remove the stones, which we'll talk about. But certainly the nephrologist is involved in preventing another stone. And so one of the biggest risk factors of having a kidney stone is that you've had one before. So talk to anyone with who's had a kidney stone. Trust me, they'll tell you, I don't want to ever have one again. And so you have
Mhm.
very motivated patients. Is the easiest patients to have in clinic.
Right.
I'm trying to control someone's blood pressure. Hey, you got to avoid, going out, fast food, this and that. It's hit or miss. Some
Yeah.
patients are motivated, some aren't, but like 99.99% of patients who've had a kidney stone certainly don't want to have another one, and so they'll do anything you suggest. And so that's where the nephrologist comes into play, is in the prevention of recurrent stones. And they could come into play if there are complications, certainly infections, acute kidney injury. If the stone is complicated, that just means that there's some things that are happening systemically and the patient requires hospitalization, then the nephrologist become involved. So a little
Yeah.
bit of, yeah.
No, that's great information. And we know some things about kidney stones. Calcium oxalate is kind of the most common
Hmm.
form of stone that's produced. There are other types of stones, right? It's not just calcium oxalate stones. There are other types of stones as well. So can you tell us a little bit about these different types of stones and maybe how their clinical presentations may look different, if at all?
as far as the incidence of stones, it's a little bit more prevalent in men than in women. It's around, like I said, around 10 to 12% overall. Maybe 9% in women, 8 to 9, and maybe 11 to 12 in men. And so it's more common in men. And the when it occurs is typically in summertime. Can you guess why in the summer?
Well, people get dehydrated. They're not
Yeah.
drinking enough water.
There you go. That's
Yeah.
pretty much it. And so, so these stones obviously are forming because of whatever you're eating. Some of the various causes of the stones, which I'll also talk about briefly. But the when it presents is typically when you're volume depleted, you're not getting much flow in the kidney, and you're producing relatively lower amount of urine that's concentrated. And remember what I said about these minerals having the opportunity to combine, right, and get bigger, where the stones can continue to propagate and also become loose and cause major problems.
Hmm.
So that's how it presents. It presents as soon as it breaks off. You don't feel the kidney stone forming. You don't really feel it until it leaves the renal pelvis. That's the part of the kidney where there's a collecting system which coalesces into the renal pelvis. And once it hits a tube, I think we have sophisticated listeners. So there's between the kidney and the bladder, there's a tube called the ureter that essentially is a conduit for urine. And as soon as it enters the ureter, that's when the ouch starts. That's when the real pain really begins. And these are, stones probably don't do it justice. These are very jagged stones, like crystals that just kind of scratch
Yeah.
the tissues on the way down, creates a lot of spasm, a lot of pain, a lot of colicky pain. The kidney is saying, well, hey, what's going on? We can't eliminate the urine, so it tries to kind of squeeze and push the stone through, and so that essentially balloons the kidney, so you can have like backaches, and as it comes down, it scratches your tissues, the layers inside of the ureter, and so you can start bleeding, and if
Wow.
urine it sits there, then that can invite infections, and then it can get really serious where you have, especially if it's on both sides. That's extremely rare for a kidney stone, but some patients with high burdens of disease, they can have bilateral stones. But most of the time it's just on one side. But depending on the previous renal function, et cetera, you can see acute kidney injury as well. And so
Mhm.
it can get really ugly really fast.